Joining us for another collegial conversation with Diana Clark. Today, our guest is Dr. Jennifer Gaudiani, who is the founder and medical director of the Gaudiani Clinic, an outpatient treatment clinic based out of Colorado. The Gaudiani Clinic is dedicated to treating folks with eating disorders or struggling with disordered eating. Dr. Gaudiani is board certified in internal medicine and completed her undergrad at Harvard. She completed medical school at Boston University School of Medicine and her chief residency at Yale. Dr. Gaudiani has been a leader in the eating disorder field for over 10 years, and in 2018 released her book, Sick Enough, a guide to the medical complications of eating disorders. Welcome, Dr. Gaudiani. We're so glad to have you here, and I will turn it on over to Diana now.
Thank you.
Such a pleasure to be here.
I am so excited to talk to you today, in part because I know so little and I am thirsty for information. So in that introduction, Laura said, treating eating disorders or disordered eating. Can you tease those out for me and talk about what's the difference, if there actually is one?
Yeah, it's a wonderful question. I should be clear that as an internal medicine doctor, I always work in a collaborative multidisciplinary team. So I am never a solo team member. I'm always so grateful to work with expert dietitians and therapists in the community for my patients whom I see around the country. That said, there is a difference between disordered eating and an eating disorder. I think that for better or worse, we have the Diagnostic and Statistical Manual 5, the DSM-5, which gives us our criteria for how we diagnose specific eating disorders. Folks who don't meet those criteria, but who are trapped in diet culture, who find themselves sequentially seeking answers to life's problems through altering their food intake, trying a new diet, or trying to change themselves in order to better show up as what society narrowly defines as a body with privilege. And for those who find their thoughts continually coming back to, what have I eaten? What will I eat? How is this showing up in my body? How is my body showing up in the world? If they don't meet the DSM criteria, they very likely do qualify for disordered eating.
So when I hear that, I think to myself, if you sit in a group of any group in this country right now, what do you think the percentages of people are who struggle with some form of disordered eating?
98%.
Thank you. Thank you. I would guess that's true.
Yeah. Strikingly, one of the things that our clinic offers is a little 3-day session called Wraparound, where patients who don't want or don't quite meet criteria for a higher level of care come for one-on-one meal support, and they hang out, and our lovely staff and I sit with them and have meals with them, and they just sort of feel how it feels in their bodies and their souls to nourish themselves in a way that they need to. And one of my recent patients said to me, Dr. G, it is so striking to me to sit with one of your staff and just watch them eat a meal. They don't make negative comments about their bodies, themselves, the food. They just get up after the meal and put the plates away and go on about their day. And she said, I so rarely get to see women modeling healthy, quote unquote, normal eating.
Yeah. I have this habit of, when I have been at sort of marketing luncheons where it's predominantly women and sitting around a table and you have freedom to order, I pay attention. What do people order? And invariably on these rich menus, people are ordering salads. I'm like, no, I think I'll have something substantial. Thank you very much.
Yeah, that's absolutely right. And, I try to model that as well. I also feel like it's important to name, because those listening to this won't see me, that I occupy thin privilege. That gives me a lot of leeway to eat with gusto and without any sort of self-consciousness in a society that when people who are in larger bodies eat the same way, they're looked down upon for that. So, it's all well and good for me to be proud of, as I am, that having had a lot of health privilege as well and no eating disorder history, I eat in a super varied, satisfying, delicious manner, restricting nothing. And I have more approbation from society doing that in my thin, privileged body. And I want to at least note to those who are listening to this for whom my body is not representative, that it's not that you're doing it wrong, it's that society is doing it wrong. And I think that's always an important theme to come back to.
So how is society doing it wrong?
Oh my goodness, let me
count
name
the
the ways.
Yeah. Well, let's come up with a few.
Yeah. I very frequently talk to my patients about the fact that they don't have a body image problem. They have an exposure to society problem. Our society has determined that there is a hierarchy of worthiness, either in terms of the positive things in life, a job promotion, the ability to buy clothing easily, the ability to sit comfortably in any space, the ability to find a partner, and in terms of the negative things, avoiding microaggressions, avoiding florid stigma, avoiding being mistreated in the physician's office. They have afforded these privileges to a very narrowly defined set of traits, which generally revolve around being young, white, thin, cis, heterosexual, able, and financially safe, at least. Very, very few people actually occupy all of those points of privilege. So as long as any of us are upholding the body hierarchy, and no one speaks about this more beautifully than Sonia Renee Taylor, who wrote The Body is Not an Apology. As long as any of us walk into a room and a friend says, "Oh, you look great today," and you say, "Oh, no, I don't. I slept badly last night and I'm not pleased with how my hair looks," the more we shit talk ourselves, the more we're contributing to an oppressive society that keeps everyone down who is deemed imperfect. And since we're all imperfect, that is bad for everyone, but it's really, really bad for the folks who happen to have fewer points of privilege. And as a result, when I talk about eating disorders with my patients, I've become more sophisticated than I was in the beginning, where I thought, okay, it's clear eating disorders are bad and they're bad for you. And, they're a negative voice and they're mean. I think I've learned to go a lot slower and ask rather than assume, what is this eating disorder doing for you? Because to the extent that people are aware of that and able to express it to me and feel safe doing so, that helps me understand what we're going to have to sub out as the eating disorder resolves, because something's going to have to fill its place. And in the case of, my eating disorder satisfies my ability to stay or move towards, it thinks, although this isn't often true, thinner privilege, then we have to really have a conversation about who are the people in your life, how can you resist some of the messages of personal inadequacy that we're bombarded with all day long.
All day long. And do you think social media is contributing to this?
Radically. I myself, so I, of course, have pictures of my family that I take on my phone, and I finally decided I'd put a bunch of pictures into a book. And I found a little applet and I designed the book. And for last year's book, I was paging through it and I gaslit myself out of my own experience. I was like, my goodness, if you look at my book during COVID, you'd think that it was all about family hikes and delightful dinners together and time with the puppy. When in fact, the pictures I myself took, the way I was curating my own saved experience, just completely deleted the loneliness, the uncertainty, the sadness, the change of plans, the set shifting. Yeah. So, the way that we see ourselves in pictures, even within my own self, the book is only going to be seen by my own immediate family. I realize that really has an impact on what we think is going on, but we have to remember there's always so much more there.
That's great. That's great. Back to eating disorders, acute eating disorders. The misconception, as I understand it, is that somebody can gain weight in the case of anorexia nervosa, somebody could gain a weight to a healthy weight and the damage is over. Let's talk about what happens in a body when somebody has an eating disorder.
Yeah, I would love to. And I think I want to preface that by saying, I'm going to use the term anorexia nervosa to refer to patients in all body sizes who are restricting calories and fearing food and fearing their bodies. We know that the DSM parses those out into two groups: anorexia nervosa, in which patients are visibly underweight, and atypical anorexia nervosa under other specified and feeding and eating disorders, in which they're not visibly underweight. The reality is that's weight stigma at work. There's no reason to divide up anorexia along an arbitrary weight line. We certainly don't do that with binge eating disorder, saying there's a higher weight binge eating disorder and a lower or normal weight binge eating disorder. So I'm going to use anorexia nervosa in a major group because that captures vastly more of the people with anorexia nervosa. Incidentally, probably the rate of those with atypical anorexia nervosa is between 10 and 100 times that of anorexia nervosa. So there is more to recovery from an eating disorder than normalizing your intake and getting your body to at least a safe minimum weight.
Right.
And by that, I mean, human beings are miraculous. Our bodies are absolutely brilliant in their ability to save us from death, to shift physiological and psychological symptoms to protect us from what's going on in the world, and then to heal after an insult is over. So without a question, whatever the eating disorder is, as people learn to nourish consistently throughout the day, to eat abundantly with variety and to satisfaction and meet the body's needs, a lot of problems that are seen in eating disorders will in fact melt away, which is so gorgeous. I mean, that's amazing. People can have been sick for a month or a year or a decade, and this does heal the body. But it's so important to emphasize that just when the body is finally at a better place, sometimes that's when the real work of eating disorder recovery actually begins. And by that, I suppose that I mean, I have so many patients who in the midst of their eating disorder tell me, you know, Dr. G, what I'm really afraid of is when I'm no longer wearing the skeleton suit, when my potassium is no longer abnormal, when my blood pressure and heart rate are okay. I'm just so worried that everyone's going to think I'm fine and they're going to leave me, but I won't be fine. I still need them. So many, many, many times I've had this conversation with patients and I say, you know, most likely treatment trauma has informed that fear because probably sometime in your past, insurance has cut when you got to a certain weight or when your potassium was better, or a well-meaning carer or family member or team member said, well, now that you're all better, you're going to do ... We're all on a journey. That is trauma. And I understand your fear, but I will tell you that at the point at which you know how to basically feed yourself and take care of yourself and begin to manage your psychological reactions to the world, that's when the fun part begins. That's when we get to really sophisticatedly move you towards what your own personal goals and values look like.
I like that. Yeah. So the eating disorder is part of the rock that we chip away at to find the other part.
Yeah, that's a really good metaphor. You know, in the past, I've said to patients, there are times to be subtle in your behavioral change, and there are times to make big strokes, as if you're a sculptor beginning to bring the sculpture out of the raw rock. You know, if Michelangelo had started the David with a little piece of sandpaper, we would not have that sculpture today. There was a point at which he had to chop off big pieces of block and make big moves. So I tell my patients, you know, when they're like, well, could I make a tiny change? I'm really overwhelmed. And look, I try to meet them there. But there are times when, based on my medical knowledge, I say, this is one of those times for a big move. Right now, you got to be brave and take a big move. And then later, when things are a little safer, we can bring out the sandpaper.
I like it. I like it. So if you wanted to leave this audience with one basic message about your work or what the hope of your work is, what would that be?
I love that. Well, the focus of the last decade and a half of my life basically has been to bring understanding, compassion, and heart to the ways in which bodies respond to eating disorders physically. And that may happen in ways that are measurable, as with a heart rate, or in ways that are non-measurable, like when your irritable bowel syndrome symptoms worsen because of stress, and that could be malnourishment stress, or it could be stress in your life. So as I've continued to refine my work and I've become very social justice oriented, I've become totally weight inclusive in my approach, I think that the main message remains, as per the title of my book, that anyone who has an eating disorder of any severity is sick enough to seek help and to change their behaviors in order to find recovery. So I wrote the book with the intention of being able to reach far more clinicians and patients and families than I'll ever be able to do one-on-one in my clinic. And I wrote it in a way that I hoped people could first look at the cover and see the diversity of faces on the cover and say, oh, you know, I can see myself in this. I didn't know that might apply to me. Let me look inside. And then in the case studies, that they could find cases and stories that also spoke to them. Exactly. And in which they could say, oh gosh, this eating disorder has always told me I'm not sick enough. I'm not as thin or as this or as that, or have as abnormal labs, or have had as many, residential admissions as so-and-so. So I probably am not sick enough to do anything. But that's the eating disorder voice fooling you. Anyone with an eating disorder is going to have physical tells. They might be subtle. They might be really, really not subtle. And every single person is worthy of getting help.
Let's end there. I love that. Thank you very much, Dr. Gaudiani. I hope you have a wonderful day out west in Colorado. I'm going to order your book. Do you have a copy of it handy so I can see a picture?
Yes, I do. Hang on one second.
Okay.
Here's my book.
Oh, I like it. Look at all those faces. Sick enough.
Yeah. So it's been such a joy. Thanks for your really, really thoughtful questions.
Thank you.